very much, Mr. Speaker. Mr. Speaker, men and women of the House, I am opposed to the pending motion, and I ask you to join me in voting no on the majority report of LD 1333, 1333. I am reminded today of the hard sell some used car salesmen are famous for. There's this sweet little cream puff used car. I've actually seen this car. It's got a few miles on it, but doesn't it look sweet on the lot? It's spring in May, so we could be whimsical, and I could think about something different from my boring four-wheel drive Corsa. So let's make that sweet little car a two-seat convertible, because we can read. So the first thing the savvy salesman does is get behind the wheel of that sweet little car. Things in your hair, you want it, you need it now. So you go right to the deal. What about the comparison shopping? Investigating under the hood. What about the research you were going to do in Consumer Reports on the maintenance record for this little model? No, you need to have it now, or someone else will scoop up this once-in-a-lifetime deal. So you plunk down your money, and you drive off the lot in a hurry. And all goes well until the wheels fall off. LD 1333 is that car. And the way the majority of the Insurance and Financial Services Committee handled the committee process is that negotiation. LD 1333 was rushed off the lot so fast that the Bondo patching wasn't even dry. And unfortunately, the consequence of this bad deal will nearly affect one ripped-off car customer, but every insurance purchaser in the state of Maine. LD 1333 promises a lot, but it can't deliver on its promises. And in the process, a lot of people, especially in rural Maine, will lose the insurance they have because they simply won't be able to afford the price increases. Sure, some people will get a price break. According to the Bureau of Insurance, the scheme in LD 1333 will lower the statewide average cost of health insurance by 3%. If you are a young, healthy guy in southern Maine, your rates could go much lower than that. But if you live in central Maine, if you live in eastern Maine, if you live in northern Maine, watch out. Especially if you are middle-aged, 48 years old and older. And that, friends, is a lot of us, myself included, because Maine is the state with the oldest population anywhere in the country. Just how much will your insurance go up? According to the Bureau of Insurance, a memo that we received after the committee vote, the changes next year will result in the following. 14.9% of the individual market will see an average rate increase of 29.9%. 29.9%. 42% of the individual market will receive a premium increase of some amount. The average age of the policyholders who will see rate hikes is 48. Maine people living in the north will experience an average of a 19% rate increase. Maine people living down east will experience a 22% rate increase. Maine people who want to keep the insurance policy they have right now are allowed to do so. But the Bureau of Insurance warns us they could see price increases as high as 170%. 170% over the next 3 years. By the way, these rate hikes are based on a 3-to-1 ratio between the lowest allowable rate and the highest rate that LD 1333 begins changes in the law that allow insurers to change prior authorization conditions whenever they want, opening the door to huge abuses and claims denials, cancer patients and others with high medical costs. It promises you can get the care you need, but it isn't going to deliver. Mandates. Although the proponents of 1333 say the bill keeps all mandates, such as pregnancy coverage, chiropractic, mental health services, it actually allows businesses to band together and offer insurance that doesn't include the mandates, making health care inaccessible. Insurers could make you drive from Fort Kent to Kittery to get your weekly cancer treatments. And if that isn't an imposition on someone going through chemotherapy, I don't know what is. It gets rid of both planning and cost and quality initiatives. Apparently, the theory is that these aren't needed because the freed up marketplace will police itself and medical costs, insurance costs will just go down. Right. All of these promises are then backed up with out-of-date, irrelevant data. There is a lot to be said for a properly designed reinsurance program. In fact, we passed one a couple of years ago, but couldn't agree on the funding mechanism. Unfortunately, LD 1333 bases the level of the healthcare tax and the premium assessment, which is an additional to the healthcare tax I mentioned, but it might be needed. It bases this level on data from Idaho, where the medical costs are more than $2,000 less per person than the medical costs here in Maine. And let me remind you, there is actually a link between medical costs and the cost of health insurance. Health insurance pays for medical costs.